Saj, we've had some questions about accident and emergency and some people having to wait long times, longer than the 4 hours. So if you could just tell us a bit about what the hospital's doing about that and how we'll be dealing with things going forward.
Of course. So A&E is measured against a 4-hour standard. So the national standard is that we would see people within 4 hours of their arrival to treatment, which is either discharge or admission into hospital. We've been extremely busy at the moment, so we're seeing in excess of 400 patients per day on average now, which is a really, really busy period for us. Our clinical teams have been ensuring that we maintain patient safety by ensuring that we're segregating patients coming through the A&E. We're seeing patients in clinical priority order as well, and of course we've still got COVID, so we're needing to make sure that we keep our patients safe and we don't inadvertently expose them to patients suffering from COVID. Overall, though, our performance is 4 out of every 5 patients coming through are seen within the 4-hour standard. So 80% of patients year to date have been seen within that standard. As a result of that, we are actually placed in the top quartile, so the top 25% of trusts as a result of that performance. But of course, I recognise that for those patients that aren't seen in 4 hours, that is a long period of time, and we need to improve and increase the throughput so that we are seeing patients in a much more timely fashion. We are working with our partners, so we're working with NHS 111 and we're working with our primary care colleagues, and we're working with community services to try and ensure that those patients that don't need to be in A&E don't come to A&E and therefore offer other services outside, and therefore that the patients who do come into A&E are the ones that absolutely need accident emergency care.
A number of questions, Saj, just about waiting times for treatment and restarting our services. So if you could just, tell us something about what we're doing there.
Okay. During the COVID pandemic, in line with the national guidance, there was a pause on elective activity, and that was whilst we were in the peak of having the number of COVID patients that we had in our hospital bed base. We did maintain for our most urgent patients, those that were being referred in on cancer pathways, so from a GP under a 2-week wait pathway for suspected cancer, we maintained our services for the most urgent patients throughout the pandemic, and we still continue to deliver on those services. We see about 1,600 fast-track referrals every single month, and up to year-to-date position, we're at a perspective of about 95% performance against that standard. So we're doing really well when it comes to ensuring compliance against that particular standard. However, individuals who were listed for more routine operations have unfortunately ended up waiting. And as a result of that, we do now have a fairly large backlog that we're currently working through as an organisation. What I'd like to show you on is that our clinical teams have reviewed all our inpatient waiting list and prioritised the patients into a priority order based on their clinical referrals and their clinical assessments. So we're trying to see the most urgent patients first, followed by those patients that have been waiting the longest. Apart from working and maximising our own internal capacity, we've been working with our independent sector providers as well within Bradford to try and get patients across and seen. So, for example, with the Yorkshire Clinic. So a number of our patients will have been seen at the Yorkshire Clinic. And that's just to try and ensure that we get as many people seen as quickly as we possibly can. Of course, if there's anybody out there who's worried and who's concerned that their position and their condition is deteriorating, what I'd ask is that they get into contact with their consultant secretary, and I'm sure the consultants will review their individual case. But we are working flat out, and our clinical teams are working to try and ensure that individuals' elective care is delivered in a timely fashion.
What's making it more difficult for our hospital to restart services this time round?
Yeah. So although the national lockdown has been lifted, we do still have COVID patients in our bed base. So at this moment in time, today, we've got 2 wards where we've got COVID patients being cared for. And on top of that, we've got some of our intensive care capacity and some of the beds on there occupied by COVID positive patients. What we need to make sure in our clinical pathways is that we segregate patients appropriately so that we don't have nosocomial spread. So this is spread of COVID to non-COVID patients. And that's really challenging because we need to make sure that our clinical pathways are completely separate. So we're not out of the woods when it comes to COVID. And of course, on top of that, we've got the winter pressures due upon us. And I've already explained how busy A&E is at the moment. So what we're trying to do at the moment is balance all of these areas. So the non-elective, the urgent demand, the COVID demand, and the elective work that we know we need to get back up and running to where we were previously.